Okay, so in introducing our next in introducing our next session, which involves presentations by two very important figures in our lives from the federal government, let me offer a small jot of information. When I was in office at Stanford, I ran a quick and dirty survey of the Ivy Plus universities. This is the Ivy League plus about 7 or 8 major prominent research universities, and asked them what percentage of their extramural research funding comes from NIH or the Public Health Service that also includes CDC and such, but NIH is the huge funder of research. And what I found in this quick and dirty survey that was, with 2 exceptions, the proportion of NIH funding in the total extramural research of these major universities was somewhere between 65 and 80%. There were 2 exceptions. One of them was not Princeton, which has no medical school. They were Caltech and MIT. I think at Caltech at that time it was about 19%, and at MIT, Claude told me it was roughly 30 or 33% or something of that sort. So I make that point not just to build up the importance of Sally Rockey, who's the Deputy Director for Extramural Research, which is known in the government as the DEETer. Sally Rockey is the DEETer. But to make the point that we talk about the autonomy, and this is a serious point, that we talk about the autonomy and independence of our research universities, and yet, if you look at a research grant that goes out to the NIH, there's a whole list of what are called assurances that have to be signed off by the office that transmits grants out of the university, assuring the federal government that the university is in compliance with a long list of regulatory or guidance requirements. Now, those requirements are not inherently bad, but one wonders whether the fruits of those requirements would exist if the NIH had not insisted that the universities do this. What am I talking about? Some of the things are a misconduct. A research misconduct policy was ordered under pressure from Congress in about 1987. The first conflict of interest policy, was 95. Public Health Service under orders from Congress. I think the FDA was out a little bit before the NIH, but for our purposes. Sharing data, having a data and materials sharing plan in your research proposal to ensure that others talented in that area have access to your materials to repeat or further your research. Posting your accepted publications, manuscripts, on a public website run by PubMed Central, which is in the National Institutes of Health. And it goes on and on. There are all these regulatory requirements that are speaking to the conduct of research. It's not about money. They're not about bookkeeping and auditing. That's not the issue. It's really regulations that have strongly influenced some of the administrative processes within universities by saying, if you want our money, you've got to have this in place, and every time you ask for a grant, you've got to assure us that you are in conformity with this regulation or guidance. And so another hanging question, which I'm not asking Dr. Rockey to address, but I'd like to throw it out just to hang until later, is when we talk about autonomy or independence, what are we really talking about? Okay, so Sally is the DEETer, and delighted that you're here, and it's yours.
I don't think it's probably appropriate to use the term hang and bureaucrat at the same time period, but And also, David, I have to question your timing of this whole conference to have the two bureaucrats in at 3 in the afternoon. It might be a little difficult. I'll start out by saying that I want to have full disclosure here. And if I were to put up my disclosures, you'd see that I have none. I have remind you that I'm a government employee, so I'm unable really to have any holdings in organizations that would have be impacted by the research that we fund. But I would also remind you, as your faithful public servant, that even if I wanted to have those holdings, I probably couldn't afford it. So that's why you're seeing a blank there. If the Stock Act actually gets implemented, you will have the delight of going onto the publicly available website and actually seeing all my holdings, so you can verify what I'm telling you, and I'm certain that that is transparency as we know it. So I want to talk to you a little bit today about NIH and HHS and our inroads into institutional conflicts of interest. And I think David's point that he just made is very appropriate. There are many expectations of us at NIH when we engage with you in research, but I like to think about this relationship that we have with our grantee organizations and our university partners as a partnership. It is a partnership. Of course, we have the strength behind us is that we hold the purse strings, but the relationship, we are dependent on you to conduct the viable, appropriate research, and you are dependent on us for the funding of that research. And I certainly think, I don't like to think of us as clients and stakeholders. I like to think of us as partners together. So that's very important, because that in and of itself provides the foundation of how we're going to work together in the future. So I'm not really going to use my PowerPoint presentation, Hunter. I'm just going to bring up one slide. And I just want to talk to you about how this all started. We're going to talk about institutional conflicts of interest, and I want you to imagine, as I put forth what we did with individual conflicts of interest, how this might translate into the future for the relationship we're going to have in managing institutional conflicts of interest. Right now, we have a regulation, as David mentioned, about individual financial conflicts of interest. We actually promulgated this reg back in 1995, and as you all know, just recently, which occupied about 5 years of my life, we went through and we reissued this regulation, and during the course of that discussion, we talked with the community about institutional conflicts of interest, and I'll talk to you a few minutes about that. But what is this regulation about? This regulation is about the individual investigator and key personnel that work on the grants that we fund. And it is all about the institution. The institution has the major role in managing individual conflicts of interest. You have the role of managing them. NIH has the role of the oversight of the process. So this is really central, because as I explained to you this process, there are those that have questioned how NIH has oversight for this and what larger role NIH ought to have in the management of your employees and your individuals at the institutions. So the way that the regulation works is that scientists that are associated with our research grants will disclose to their institution the significant financial interests. There's a de minimis of $5,000, anything related to their institutional responsibilities. In the old regulation, it was only about research responsibilities. In the new regulation, it's about institutional responsibilities. And this broadening of what is disclosed to the institution on the part of the investigator has really, in many ways, pointed to institutional conflict of interest policies, because now investigators are reporting about their responsibilities and their relationships that might impact their clinical work, might impact their teaching, and all activities beyond research. They disclose that to the institution. Then the institution determines whether or not that significant financial interest will, in fact, you could question the objectivity of the research. This regulation is all about assuring objectivity in the research. That is what we are interested in, and this is what the institutions are looking at. So every disclosure of a significant financial interest does not mean it's a conflict of interest. It simply is a way for the institutions to know what the relationships are of their own faculty and other researchers with their outside interests, and to then make a determination of whether or not that is a conflict of interest. Then we at NIH get information about conflicts of interest, and we also then have oversight to this process, as I managed before. In other words, we have to conduct compliance. Now, if you think about broadening this and the role that the government will play in stepping into the world of institutional conflict of interest, it all has to come back to what the government can also do in the area of compliance. How do we assure that institutions are in compliance with any policies or regulations that we put forth? So when we think about this again, that role of the institution being so central to this is really the framework for how institutional conflicts of interest, of course, are going to be looked at. And in this role of the regulation here, we are in the business of trying to promote objectivity, and we are not in the business of trying to hinder the relationships of individual investigators with their outside activities. The real idea here is that the institution will manage whatever financial conflicts of interest arise. And in our case, what does management of a financial conflict of interest mean? In the biomedical research world, it might mean a number of things. It might mean that an investigator cannot participate in that research. But it can mean many other things. It can mean that they could put in an independent data analysis group. It means that they could prohibit the investigator from recruiting patients. There's a lot of different ways that institutions can manage conflicts of interest short of actually having that person either have to step down from research or totally divest of their own interests. So when we've gone forward with this, as we went forward with the process of putting the new regulation together, it began about in 2007, we went on and put out an advance notice of proposed rulemaking, and we asked two questions about institutional conflicts of interest. How would institutional conflicts of interest be defined? And what would institutional conflict of interest policy address in order to assure objectivity? So that was really the two questions that we asked of the community. And it became very, very clear as we came forward that there was not a clear definition of institutional conflict of interest. This was one of the fundamental issues that we were going to face if we thought that we should have to in some way put a policy or regulation or something in place. We've heard this today from every one of our speakers about their opinion and their opinion on what constitutes an institutional conflict of interest, but there was clearly not a subscribed to definition that universities use in order to manage it. We had a lot of different viewpoints on this. It was very interesting how we had different viewpoints depending on whether we were getting a response from an investigator, whether we were getting a response from a research, and from the research administration, whether we were getting a response from a professional society. We had very different responses here. So what we did after this was over, we went back and we put out a notice of proposed rulemaking. And when we did that, we asked the question in the proposed rule whether or not, or we actually said that institutions should adopt, and in order to receive an award from the Public Health Service, HHS or NIH, that they would have to have a policy on institutional conflicts of interest. That's all we were going to say, that they were going to have a policy. We did not describe what that policy was going to be or what the definition should be. We should just say we will propose that you will have to have a policy on institutional conflict of interest. Well, this caused an uproar in the notice of proposed rulemaking. And when you have a notice of proposed rulemaking, this whole regulatory process, you are allowed to go back before the final rule and reconsider things. And we heard very clear, the messages we got from the community was requiring institutions to have a policy on institutional conflict of interest without providing any other guidance could really cause massive confusion in the community. There would be additional information and much more deliberation that would be needed to formulate so much more guidance. And thus, with these two things together, we decided that it wasn't the point that we wanted to add institutional conflicts of interest to our discussion and our regulation of individual conflict of interest. Now, in the meantime, we're going to hear from Julie, but the Office of Inspector General had been looking at our financial conflicts of interest policies. And they, in 2011, they issued a report that basically said they went across the universities and looked at their institutional policies, their institutional financial conflicts of interest policies. And they found that many institutions did have some policies. They were mostly about institutions holding equity in non-publicly traded companies. That's what the primary strategy was there. But when you look closely at those policies, what you found in them was things that I would not necessarily equate with institutional financial conflicts of interest, but more equate with institutional research integrity. They were things like ensuring open exchange of research results through publications, disclosing financial conflicts of interest on informed consent forms, things like that. So it was more about research integrity than really the management of financial conflicts of interest. So the Office of Inspector General came back to NIH and said, we believe that you should promulgate rules on institutional financial conflicts of interest. So the question is for us today, and I don't want to have a long talk here, I want to talk to you about what this might mean for the federal government to step in a regulatory fashion about managing institutional conflicts of interest. My opinion here is that, first of all, because of the definition is not clear, but secondly, the institutional financial conflicts of interest go to the very fabric of how an institution is constructed, how they manage their employees, how they manage their decisions, how they manage their endowments, how they prescribe drugs at their hospitals, and what kind of holdings their deans and chairmen and provosts and presidents can have. It goes way beyond the biomedical research community. It certainly is something that has to be, as we've heard all throughout the day, something that has to be applied across the institution in all areas. It also goes way beyond research. And so to the degree that a federal agency that in the health world would step in here and promulgate regulations is a little hard to imagine. However, we all believe in the integrity of the process, and what we are trying to do is to assure that outside influences are not impacting the objectivity of research. So I think we all share a common goal. How that finally gets manifested in how we would go forth in regulating this is what's in question. Now, I would like to just give you a little case study on a recent case, and you've probably been hearing about this, about MD Anderson and Dr. Ronald DePinho. He is the president of the Anderson Cancer Center, and this has all been in the news. In fact, I'll tell you a little update from last week. This demonstrates to you how individual conflicts of interest and institutional conflicts of interest have a gray area. It's not necessarily totally clear how you would distinguish the two. But in this article, he had asked for waivers. In fact, they were some of the conditions of an employment about whether or not MD Anderson's institutional conflict of interest policy would allow for him, basically, about 10 companies that he had holdings or else had stock or had relationships with, whether or not those companies could also sponsor future research at MD Anderson. And of course, this immediately set off bells. Our Senator Grassley, of course, came and started asking questions about this. Miraculously, NIH was not pulled into it, but we heard all about it. And he was against the idea of allowing the president to retain his outside interests. The University of Texas system took a look at this. There were 3 companies which the waiver was requested. 2 of the companies were actually companies that he was a co-founder of. So he had a great amount of stock, over, I think, $5 million in stock on some of these companies. And he also wanted to assure that faculty members that worked at the Cancer Center would be able to conduct this research and accept research funds from these organizations in the future. Now, this is, when you think about institutional financial conflicts of interest, often they come back to individuals. So in this case, this institutional conflict of interest as a whole came back to the individual. It was the president of the organization. So I just read this morning that last week they allowed the president to keep his holdings. They were going to put the holdings in a blind trust. This was one of the ways that they were seeing that they were going to be able to allow some degree of him to be able to keep them, and putting them in a blind trust took some of his power away to manage those funds. And I don't know what the consequences of this will be with Senator Grassley. The idea also is that he would also, if certain profits that would be made would be donated to certain charities. That was another avenue of it. But by granting this waiver, then those researchers that work at the Cancer Center would then be able to either accept funds from some of these companies, or, for example, work on NIH projects where the company was also a co-sponsor, or work on federally funded projects where the drugs or the other therapeutics were developed by those companies. So I'm sure that Senator Grassley is not happy with this outcome, but it demonstrates to us in this case that we have to look at institutional conflicts of interest in many ways. And one of the ways we can think about that and how that would impact what NIH does is to think about them in the realm of individual conflicts. So you can imagine a scenario. Now, I'm not saying that this would be the most positive scenario to happen, but you can imagine a scenario whereby NIH would say, it's not just those individuals that are supported off are actually conducting the research under a particular grant. It is also those individuals at the levels above. So it's the individuals at the chairmanship, at the deans, at the provost, at the president, somewhere above, whether or not those individuals' significant financial interests have to be managed as well in order for you to accept these funds. That is very broad-reaching. Those are broad-reaching tentacles. And that direct link to our research grants becomes more diffuse, and that ability for us to manage through compliance of those particular relationships becomes much more diffuse. So you can understand how it is complicated for us. Now, at the same time, when this is all going on, as you know, NIH has developed a new Center for Advancing Translational Research. And so our idea with our new center is that we recognize that there are ways to take the therapeutic development pipeline, and try to study it as a scientific question and to understand how we can make that pipeline more effective. And so we're trying to catalyze new innovative ways and methods and technologies for developing, testing, and implementing diagnostics and therapeutics. So when this happened, when NCATS happened, there was a lot of discussion in the community about what the role of NIH is in the pipeline from basic sciences all the way to translational sciences. And also, if NIH is fostering relationships between universities and the private sector, what does that mean for managing financial conflicts of interest? Because we have some very specific programs where we actually are specifically fostering these relationships. So let me just give you an example of one of these. We have a new program called Discovery of New Therapeutics Using Existing Molecules. And essentially, this is our rescue and repurposing program. And if you think about the therapeutic pipeline in drug development particularly, we may start out with 10,000 compounds, wait 10 to 15 years, and only one of those compounds actually gets FDA approval and is available for use. There's got to be ways that we can use compounds that fall out across that process for efficacy reasons, not for toxicity reasons. If they fall out because they're toxic, we're not interested in them. But if they fall out for efficacy reasons, in fact, they just didn't simply work for that particular condition, then we can think about those drugs and try to repurpose them and use them for other diseases and conditions. So what this program does is that we have three initial partners, which were Pfizer, AstraZeneca, and Eli Lilly, and they agreed to open up their libraries of compounds to universities. And we actually sent out a request for applications. We got the applications in. Now, what was one of the most critical issues in developing this new program? one of the issues was the intellectual property. How are we going to incentivize industry to come along and agree to be part of this program if they were to give up intellectual property rights to those compounds? So we have actually worked through some templates of a new agreement that universities and the companies can use to have the companies preserve some of their IP rights to those compounds that are now going to be repurposed. We're in the midst of this program. We've had conversations from the very start of what this means for managing conflicts of interest. You are, during the course of this program, we imagine there's many, many more relationships that are going to be directly linked to our funding of our research grants with industry and university partners. And so it's going to be very, very important for NIH as it goes forward in fostering these relationships to assure that the research is done in an unbiased way and that objectivity is preserved. Right now, what we're doing is simply looking at the individual conflicts of interest and assuring that those individuals that are participating on those grants don't have holdings with the companies of interest. But it can go far beyond that if you think about the broadening of these kind of relationships. So I know I've been talking a while. I just want to end, if I can find my last sheet here. See, Hunter, if I don't use my PowerPoint presentation, I'm hopeless. Let's see, I can find it. Okay. So I just want to end by just going over some of the concepts here. One of the concerns we have, and we think, first of all, this is about a culture that we are establishing within our community. This is about a culture among the universities, along with our partnerships with the federal government, and that we need to establish this culture and really define what we're talking about when we're talking and discussing institutional conflicts of interest. We recognize that a significant portion of managing even institutional conflicts of interest is about an individual. And we believe that what we did in enhancing the way that we changed our regulation was to enhance at least the way you can manage individual conflicts of interest, which in part does help with managing institutional conflicts of interest. And while that connection to NIH research is indirect when it comes to institutional conflicts of interest, sometimes it really doesn't even exist. So we believe this is far beyond NIH, this is far beyond HHS, and this is something that the government as a whole, along with the university as a whole, has to talk to. So our interest is objectivity of research. Your interest is the integrity of the entire university. And as goes for the integrity of the funded institution, so goes the integrity of the federal organization. So it's very, very important to us. So I appreciate having a chance to talk to you today and be happy to answer any questions.